Here we are once again at ViVE for the On the Road at ViVE edition of the Reverse Mullet Healthcare Podcast. And I am Ellen Brown, one of the co-hosts.
I'm Dave Pavlik.
And we are here with Dr. McGill, who I think is still wondering why he's here. Yes. But there is a legitimacy to why I reached out.
That.
And it was not noisy. I legitimately only reached out to a handful of people. We had this podcast booth for, I think, 10 or 12 guests in total. And so we were very picky about who we picked, and I wanted to have rural healthcare covered.
Awesome.
So,
even though you weren't the first one, you were number one on the list.
Well, I'm glad I was 11 of 12. I appreciate that.
you were not 11 of 12. So tell us about yourself.
Well, thanks for having me. In all
welcome.
seriousness, I appreciate being on. It's always great to be able to tell our story at Community Health Network. So I serve as the Chief Transformation Officer at Community. Community is like it sounds, community-based health system based in Indianapolis, Indiana. 16,000 employees. We do everything except for transplants or pediatric subspecialty. 5 main hospitals and 4 smaller hospitals. Market leader in behavioral health, market leader in women's services, market leader in oncology, market leader in primary care. So as the Chief Transformation Officer, I have responsibility for everything from IT and analytics, pop health, value-based care, informatics, clinical and nursing informatics, and then I have some operational responsibilities of things like home care and hospice and palliative care, geriatrics, care in the home, and then all things partnership transformation. So partnerships with Epic and Microsoft and digital companies across the board.
So tell me about your panel tomorrow.
The panel tomorrow is really the focus of how do we use technology to advance rural healthcare, specifically with the Medicaid population. So I feel like I'm just riding side saddle on this distinguished panel. We have the Chief Medical Officer from Alaska and a gentleman who used to run Medicaid at the national level.
I tried to get him.
Yeah.
And I was noisy to him.
He said no. Yeah.
He didn't say no. He didn't answer.
Well, I'll give you a shout out tomorrow on the panel.
I would love that.
And then I'll guilt him into saying.
Okay.
Can you wear the mullet on the panel?
No, he is not. It would be awesome.
It would definitely add to my credibility.
Well, the health people love it because we get to wear this cool sequin jacket because of our mullets.
There you go.
So it's
there
really I literally got to don the coveted sequin jacket that's got health emblazoned on
I
the
saw
back.
somebody with that earlier. I was
I've
very
got
jealous.
to wear it.
I was jealous.
It's so cool. All
So
right.
we're talking technology and how we can address, change, but it's more than just technology for rural healthcare. It's how do we affect policy? How do we affect payment? Certainly with provider shortages, how do you really address the needs of, and I think you're going to hear that Alaska has been doing this for a long time because they have a lot of rural healthcare. Indiana, believe it or not, it's hard to believe, but there's counties in Indiana that don't have a primary care doctor in them.
I'm not surprised at all.
And so, you think about that and think it's 2024. How do we have places in the United States that are populated? We're not talking about rural, Alaska or rural Montana where there's nobody living there. We're talking about places where people live and we don't have primary care services or primary women's services, OB, and other things. So that's what the panel's about.
So, all right. So let's ask the question, right? So our focus of our podcast is to create a platform to talk to thought leaders about how to affect real, all caps, change in healthcare, because we are all stuck working on the incremental change. We have to. We can't throw incremental change out with the bathwater. We would be in real trouble then, although maybe we would do things faster if that happened.
True.
So, but we Dave and Justin and I felt like there wasn't a platform where people felt comfortable enjoying themselves a little bit, talking about something that we all need to talk about, because that's how you come up with ideas, is that whole kind of spitballing and just thinking about it. So tell us what you think could affect real change in healthcare.
Well, so we've taken the approach. So I, as the Chief Transformation Officer, one of the things that I tell myself, I tell my boss, I report to the CEO, I tell the teams that I lead, is if we're not waking up every day making people a little bit uncomfortable, we're not transforming anything. So it starts with that, right? We've got to move the needle. And like you said, it's incremental, but that starts the real change. The other thing is we have to do a better job of painting the vision, which I sometimes think that we do a good job and other times we don't do a good job. We also take the approach of leveraging our partnerships. So we know that we can't do this alone, right?
Yep.
We're a community-based health system. We don't have a lot of the resources that maybe some of the larger systems have. So how do we do this through partnerships?
Yep.
And my value prop in that conversation is 90% of the healthcare is delivered in the country at places like Community Health Network, not some of the big names that you see, the big logos. So if we can impact change, you can make that change at 90% of the systems. And so that's really the approach that we do. So it's painting the vision. It's who are you partnering with? And then again, how are you waking up every day to drive that change?
Yeah. No, I mean, I couldn't agree more. We had Febby Abraham on recently, and I, not the exact same strategy, but I appreciate his strategy of looking at their health. So he's very much a proponent of moving from sick care to health care. Mm-hmm. And so his approach to transformation is a slight spin on that variation of partnership, but we have to acknowledge that we need to be the quarterback. The mm-hmm. health system needs to be the quarterback. They don't need to control all of the assets. Mm-hmm. And they don't need to try to push everything into assets that aren't the best, right? So it's like, let's just try to control volume. Let's just try and hold on to everything that we can. And let's try to avoid risk. And, let's try to slow the trajectory as much as possible. But instead saying, hey, let's pull everything together so that we can make that shift more rapidly without breaking the bank, right? And then leveraging some of what we've invested in order to do that. And so I'm appreciative of, we can't do it all ourselves,
right?
Because that also creates a bias that I don't think is necessarily healthy either. So.
Yeah, and I think COVID taught us or the pandemic, I should say, taught us some things that maybe we shouldn't be everything to everybody. Exactly. Quite frankly, it's hard for not-for-profit health systems to be everything to everybody anymore with the other challenges that we have on payments and volumes, et cetera. So it really is, how do we continue to be smarter and deliver more services to more people, leveraging technology, leveraging partnerships, and really trying to understand what we should do and what we shouldn't do.
Yeah.
I started listening to a book this morning called Things Never Change. And it really sparked. I was talking about this at lunch. It sparked my thinking about the premise of the book is focus on things that never change, because those are the things that are predictable. And so how does this? It's not a healthcare book, right. But it's how do you translate this to healthcare? So Amazon, Jeff Bezos will tell you, people are always going to want low prices, and fast shipping. Doesn't matter what you're selling or buying, low prices and fast shipping. So how does that translate to healthcare? What can we deliver upon that's predictable for the future so that we can manage? Because I think sometimes we get to your question about driving transformation, we get hung up in trying to predict what the next transformation is. And that's very hard. So how do we, again, focus on what's not going to change? High quality, best outcomes, access, transparent costs. I mean, those things are never going to, I shouldn't say never, but never going to, they're always going to be important to people.
They're always going to be requirements.
They're always going to be requirements. So how do we focus on that and then make some strategic bets in the other areas?
Yeah, it's awesome.
Did you listen to that book before or after the latest episode of the Reverse Mullet Healthcare Podcast?
Definitely before.
Yeah, we have an episode on change.
We really appreciate you stopping by, especially since you didn't know what you were walking into.
Yes, we do. Thank you for playing along. So, see, we weren't all just silly.
That's right.
That's right. It was all good.
Right. I appreciate you having me.
Thanks, Dr.
All right. Thank you.
Appreciate that.
Okay.